Welcome back to the Mountain Morning Show. We have Allison Page, who's owner and therapist of Trail Talk. I am so excited to meet you. We have so much to talk about. Tell me about your business.
Well, Trail Talk is a novel way of doing mental health. Walk and talk therapy is not new, but Trail Talk is about opening the doors of the traditional therapy office and shedding light on the stigma and shame of emotional care for active folks like you and I and those watching the show. There's a disenfranchised group of people that we're missing, and those are active functional people who don't feel like they're sick enough to seek therapy, or they're like, well, I really should be able to do this on my own. So I'm really trying to target that niche demographic.
So we have a lot in common because I am a Zen therapist. My training's in Zen, not psychology. And I've been doing therapy sessions on skis for 15 years. And I've never met anybody else that kind of takes it off the couch and out into the mountains. I've also done events while hiking, while mountain biking, while golfing, all of that. So we have that in common. That's why I'm so excited to meet you. And then I went on your website and I saw a blog post, you know, your emotions, run but you can't hide from your emotions. I just wrote a book about that, about fear. So what do you want to talk about? We have so many things in common, and I'm going to leave it up to you to kind of guide us then. I know you want to talk about fear. Do you want to start there?
I think it would be great because we all, at some point, well, our brains are so powerful and we're always future focused, or we're living in the past, woulda, shoulda, coulda. So I wrote that particular blog post about, and I have this metaphor that I call Rocket Man. And Rocket Man travels in his mind into the future and the past. And being present, and you've studied mindfulness obviously, is being present, there's no fear. Fear resides in the future and the past. And that's why I brought this balance board for you to take a look at that, because I use that as a metaphor. Because when you're in the present moment, it's a dynamic process. It takes all 5 senses for you to stay present. You got to have your feet planted on the board. You got to be paying attention to that proprioception, as you well know as an Olympic skier. And so when you're in the present moment, you don't have enough time to worry. You don't have enough time to be afraid. So that's kind of the metaphor I use.
I like doing something physical, you know, when you're afraid, and like we go skiing, we go mountain biking, like there's an element of fear there. And if we're willing to feel the fear, then we go into our bodies, which lives in the present moment. You know, the body doesn't project past or future like the mind does. And so I love that you brought this. Of course, I'm wearing heels. Right? And so are you.
I know, and I thought because you are the athlete, I call myself the adult onset athlete. That's going to be my book. I would love to hear more about your book because we both know that why should we be saving wilderness therapy experiential techniques using nature as our therapeutic milieu for wayward teens? My goal with Trail Talk is to bring those therapeutic principles, modalities into mainstream private practice. People do walk and talk, but Trail Talk's all about offering signature walk and talks with those that don't normally seek emotional care, especially men. Really attracts men to say, you know, I'd really like to talk to someone about an issue. I just don't feel sick enough. It feels less clinical walking and talking. It affords for intermittent eye contact. When you're in the sun, as you know, there's a little bit of release of endorphins. And when you decrease the emotional valence of a topic or intensity, then you're able to put your thinking cap on and you can think and feel at the same time.
So when you take your clients out walking, I mean, you've just explained a few things that is the difference between just laying on a couch or talking inside of a room. What else? Like, does more get revealed because they're in their bodies and they're moving energy?
Well, yes, and it affords for intermittent eye contact. So some people that have never been to therapy think it's still Freudian, that you lay on a couch and you stare at this stranger, and people have intrusive thinking. Teenage boys, they're like, oh my gosh, I'm looking at this grandmother or this young woman or this man. I don't know can they read my mind? And so one thing about being outside, it just feels less, it just feels more natural, and then you can choose to look at each other as needed. So that affording intermittent eye contact is really powerful. And then, as you know, that bilateral movement is very left brain, right brain, very EMDR. I don't know if you've heard of that treatment modality, but I do EMDR as well. So and then just being outside is just, nature heals.
It does. And if you don't have a lot of time and you need therapy and you need exercise, like boom, perfect storm.
Right, yeah.
You know, I know that when I'm having issues with my husband, it always helps for us to go for a walk together. And a lot of it is just simply explained by the fact that we're not in eye contact. You know, and then we're also in our bodies.
Yeah.
And it just seems like a more gentle, peaceful place
Absolutely.
to have a difficult conversation.
Yeah, we do marriage and we do couples walk and talk therapy too. It's really fun. I really enjoy it. We have several therapists on the Trail Talk team that work with couples.
Yeah, when I do it with skiers, like we go in deep and we explore different forms of consciousness while we're actually skiing.
Yeah.
It's really powerful.
Yeah. Many of us live in our heads. We're thinkers, and we're afraid. It's called affect intolerance, afraid of strong emotions. When we're children, oftentimes we aren't validated. I'm scared. No, you're not. It's cold. No, you aren't. You know, that kind of feeling. So over time, you stop trusting your intuitive sense. And you're like, well, I guess I'm not scared. But then what happens is anxiety builds. And I wrote another blog about I'm a little teapot, because it's like the metaphor of a teapot. You get this squeaky is underneath the boiling emotions. And we really got to learn how to feel those emotions, not be afraid of them. Feel them, name them, and then choose how you want to respond to them.
And this is a great way to segue into this balance board.
Yeah.
But, you know, to what you were just saying, though, with your children, the first time they say, I'm scared, I feel afraid, the parent just innately wants to say, oh, there's nothing to be afraid of. And it's very well intended, but it sends a message that fear is not welcome. I call it fear shaming.
Yeah,
you know, it's not true. There's a lot to be afraid of, right? Or when child's sad, you know, turn that frown upside down.
Right.
Sadness shaming or anger, you know, we don't do that in this family. That's anger shaming. And so then they feel like if they want to be a good child, then they can't have fear, anger, or sadness.
Absolutely.
And it starts the madness of emotional repression.
Yeah, our parents model how we deal with emotions, and so no, you're not scared, you know, buck up, whatever. And we invalidate. So we need to validate the emotion. Just name the emotion, because if you name it, put it out there, then you can choose how you want to deal with it. Emotions inform us. Anger brings us to action. Fear keeps us safe. Sadness, we have to mourn. If you don't mourn, that's a whole nother topic. But you know, emotions are really, they're God-given emotions to inform us, to keep us safe.
Well, emotional intelligence is too often seen in our culture as our ability to intellectually understand our emotions and control them.
Right.
So next thing you know, we're in our head trying to talk or think about our emotions versus feel them. And then you really can't understand fear. I mean, how do you dissect that, right?
Right.
And then to control them, you know, leads to the repression. So give me your version of emotional intelligence, and we'll kind of take it into this balance board.
Well, it's learning how to recognize, and it's an emotional language. Some people are really good at identifying, you know, I'm frustrated. So fear is on a continuum. It's like, I see it like a thermometer, you know, a little bit of fear, a little bit of anger, I'll use anger. A little bit of anger is being kind of ticked off, and then you moved up, I'm kind of pissed, and then I'm really frustrated, and then you go ballistic and you're raging. So it's on a thermometer, and really understanding that there's different levels of anger, and then recognizing that you have a thought that, oh, I can't do this black diamond, and then it goes from thought, and the feeling is, oh, I'm really pissed at myself because here I am again, you know, I've been doing this forever, and you just get pissed off at yourself. And then you react and you go back to taking your skis off, or, you know, doing the stem Christie, whatever. So that's a common CBT, cognitive behavioral loop, where you think, you feel, you respond with behavior. And it can go both ways. So if you can change your thinking, you can change your feeling, which is going to help you respond versus then react. Does that, you know those principles?
Yes, I do.
Yeah.
And I add in there judgment, because when you think, there's always a judgment.
Yes.
You know, fear, bad.
Right.
Anger, bad.
Right.
Sadness, bad. And so with that judgment, then there's the repulsion or the resistance to the emotion. And like skiing, for example, if you resist the emotion, then it becomes problematic. But and we were talking about this earlier, Terry and I were, but if you embrace the emotion, then it just shows up as focus, excitement, higher states of awareness. Like there's a reason why extreme sports takes people into the zone, and little else does, because of the fear. And because the athlete's willing to feel the fear, you know, that combination is what takes you into those higher states.
So you need to allow yourself to feel it, and then you have to name it, and then you have to realize it, get it outside of you and say, okay, it doesn't need to own me, I can own it. Now I can choose what to do with it. And then once you do that, that's the emotional intelligence, being able to really understand how you're feeling and making a choice about how you want to respond.
All right, so I'm looking at this balance board, and I feel scared. And I'm not scared of injury so much as looking like a fool in front of these cameras. And I'm wearing stilettos. I mean, they're only what, 3 inches, but I don't wear stilettos. Like I don't wear heels for starters.
You can take them off.
So I'm gonna, you know, because I want a little bit more fear, because it'll be more fun for me.
And also that whole area of judgment, we judge, and when you get into the present moment, you know, we don't have time to judge, and that's a whole nother topic we can talk about, is how to stop judging ourselves, and then we'll stop judging other people.
All right, so you ready for this?
Judge you.
Are you going to do this too? So
no.
I'm getting my stilettos firmly on the balance board.
And this is what I do with my clients.
Okay.
Get them started.
I want to do it. Well, get me started.
Okay.
Yes.
Get you up here.
All right. All right.
And you can just get your.
See, now I know that I look ridiculous.
No, you don't.
I don't.
You're doing it, man.
I mean, I have this skirt on.
Yeah.
Okay. Hey.
But you know, you keep your knees bent. Always keep your knees bent. You're ready. Look it.
All right, your turn.
No way.
And let me just tell you what my practice was there. It's like I'm merging with the fear.
Yes.
And it helped me be better athletically on this thing, because I didn't want to look like a fool, right?
Okay, then that was my problem. I don't want to look like a fool because I've been doing this for a lot of years.
Okay, let me help you. Do you want some help?
Yeah, you're going to help me, because I've got these on here, stand right in front of me.
Okay, right in front of you.
I just have to get onto it.
Okay, what's going on with you and fear right now? What are you afraid of?
Getting hurt. Nothing.
Nothing.
I can actually hula hoop and boogie board at the same time. It's a great party trick.
You've done this before?
For years.
Okay.
This is old. This is vintage.
Wow.
I taught my kids how to do it. Yeah, we used to just keep it in the living room and hang out. My son can do like a 360. It's cool. Adult children now.
Okay.
Yeah, but isn't that fun?
That was really fun.
It's great exercise too.
So last bits of advice about fear, like somebody's sitting at home right now, maybe they don't have a balance board, but how can they experiment with fear today and feeling it instead of resisting it?
Well, right now I have a little bit of fear, a little anxiety, because I've already moved. I've been thinking about what am I going to do next client, and so it's really to stop and just say, okay, Allison, and talk to yourself kindly, because we're so mean to ourselves, and life will be mean to us, people will be mean to us, so we need to be our best friend. So it's like, okay, talk to yourself, call yourself by name. Okay, Allison, what are you feeling? Well, my stomach, I'm feeling this feeling in my stomach. So there's an acronym called STOP, and it's a mindfulness technique. So you stop, you take a breath, because as you know, as an athlete, when you slow your breathing, it slows your heart rate. And so then you stop and you say, okay, what's going on? Well, okay, observe. Stop, take some breaths, observe. What's going on? Well, I'm feeling really anxious in my stomach. Where do you feel it? Because everybody feels it. Some people have never learned to identify where in their body they're feeling an emotion. Sometimes that takes a lot of practice. I feel it in my stomach. I get butterflies. What about you? Where do you feel it?
I often feel that in my chest and throat.
Yeah. And so you stop, you observe, okay, there it is again. Okay, and then you pull back, like a panoramic view, and you get another perspective. Okay, so is there another way of thinking about this? Yeah, I have a big day, but I'm excited about it. So again, it's another mindfulness technique that we can get into at another time.
So your website is trailtalk.com. They can find out more.
Yeah,
right.
I have an e-newsletter. I've got a blog.
Great.
Yeah.
It's wonderful to meet you.
Great to meet you as well.
So enlightening. Thank you.
Really
and
fun.
We'll be back soon with more from the Mountain Show, the morning show.